testing is important, and I'm talking with Donna so you can see what's going on, especially when it comes to syphilis. It's a thing. You have to accept it. We're going to talk about it. Don't change the channel. According to the Lucas County Health Department, cases here in Northwest Ohio have been on the rise for years, but if the right steps are taken, it is preventable. So this afternoon, I'm here with Donna Fox. You are the HIV and STI prevention and management specialist for the health department. Tell me a little bit about why we're having this conversation. Donna, like I said, it's not comfortable. This isn't fun. It's not sexy. It doesn't make me hungry. It makes me twitch a little. Why is this important?
This is important because we can save the lives of babies. Congenital syphilis is serious, just like our billboards say, but congenital syphilis is serious. That's when a mother who is pregnant has syphilis and delivers a baby, then the baby has syphilis. And that's a big deal because the baby can be born with birth defects, including bone defects, neurological defects. They can have developmental delays. They can be born stillborn or die shortly after they're born. So it's serious and it's preventable. So if the mother, CDC guidelines recommend that women get in and get tested and treated for syphilis in their first trimester.
Okay.
If they're at risk of possible exposure anytime then throughout the pregnancy, they should be tested again at 28 weeks, because the great thing is that if we treat within a month before the baby is born, we can prevent syphilis in the baby.
Okay, so this is necessary, like you said, congenital, it's an issue. Now, when it comes to syphilis, it sounds so big, like I haven't had it, so I don't know. But okay, so warning signs. How do I know when something's a problem? Let's talk treatment. Let's talk options, because you know some folks just may not know.
Okay, so let's say this up front. Go to lucascountyhealth.com. We have lots of information on there. But basically, the first sign or symptom of syphilis is going to be a sore or a bump in your sexual areas, but that could include your throat. And it could be in a place where you're not seeing it, and because it's painless, you may not know it's there. So that's why you have to look at the risk factors and say, if I have a risk factor, I should be tested. And my partner should be tested as well once I'm diagnosed.
So when I find out I'm pregnant and then it's just, okay, but my partner and I have been together and we love each other and we trust each other, there's no need for testing. Don't do that.
It's a smart move to get tested at 28 weeks.
Got you. Okay, so then, and why exactly? Because we've been looking at a lot of different graphs here. Tell me some numbers. Why? Because, you know, we're not Columbus, we're not Akron, we're not Cincinnati, we're small, we're Toledo. We don't need this.
We're Toledo, and we are amazing, and we've got a great community partners, great medical providers. We've got a lot of great things going on. However, we have to know that in 2011, we only had 19 cases of syphilis.
Yay.
Okay, yeah. Now we fast forward to 2022, coming out of COVID, 183 cases.
Ew.
Big deal.
Yes.
A really big deal. So we have to address it. We have to control the infection. That's our job in public health, right? To meet with the infected person, help make sure that they're tested, treated, because you can treat for syphilis. It's a blood test. It's important to know that it's a blood test. So if you think you've been tested for everything, but you didn't have a blood test, you weren't tested for syphilis. But we can treat you.
Okay. But I feel shame now. Let's say I've got it. I feel shame. You don't want to see me. I'm in a sense, because again, we're more so talking, especially when it comes to those pregnant or pregnancy. This is embarrassing now, because like I shouldn't have this, so I shouldn't get treated. It'll just go away on its own.
Ah, that's a very good point. Syphilis does not go away on its own. You need to be tested to confirm whether you've got it. If you have it, you need to be treated, and it can be treated. So it's totally manageable if you take the right precautions of being tested if you're at risk. Of course, if you're sexually active, have anonymous partners, have multiple partners, using a condom is what you should be doing.
So protection is key in all of this. So if I use a condom, I'm not going to get it, or I'm less likely to get it, technically?
Syphilis sores can spread the virus, and that's actually when they're the most spreadable. So that's when they're the most contagious. So there's a possibility that you might not know that you have the sore. So I'd stick with a condom.
So again, prevention, going in to see you all / going to the website to ask those questions, because again, sometimes it can be painless. You can be unaware of these things. When it comes to us versus other cities, major cities definitely, are we getting better, getting worse? Because we went from 19 to 103, so it's just like, oh dear, are we back on the rise again now in 2023, or what's going on?
Okay, so 2022, we came down 12%. We are proud of our community because one, we knew that it took the medical community, it took public health, and it took community members talking with other community members and being an influencer. So it took all of that to bring us down 12%, which we think is amazing. Right now, we're hanging steady in 2023. But we're right on the cusp of increasing, and we've got another month yet to go, and we need to just keep pushing, keep being aware, because the quicker we identify the infection, the more likely it is to spread, and we can help you.
It's just that simple, says Donna. Donna, okay, is there anything else you want to make sure that we mention when we talk about it? Because again, it doesn't just affect you as a person, it can affect your partners, and if you are carrying a child, it can affect likely in a negative way. It can make things worse for them just starting out the gate. Is there anything else that we definitely need to know or be aware of going into this when it comes to this problem?
If you're pregnant, get prenatal care. That's the most important thing, the best thing you can do. If you are at risk of contracting syphilis, if you've got anonymous partners, if you have multiple partners, if you're not confident that your partner only has one partner, use a condom, come in and get tested.
Okay. And there's no shame in that. All right, so again, if you want to find out more information, go ahead to lucascountyhealth.com. There's all that, and of course, you've seen the billboards forever. Syphilis is serious. I agree. I don't know why anyone made it a joke, but thank you, Donna, for taking the time. It's an uncomfortable decision, but it's something we have to talk about.
We're glad to do it. Thank you.
Thank you.